Diabetic foot wounds are among the most devastating complications of diabetes, chronic, slow healing, and often leading to amputation. Despite advances in wound care, millions of patients worldwide struggle with wounds that simply will not close. But a new frontier in medicine is offering hope: stem cell therapy. In this video, we explore how stem cells are transforming the treatment of diabetic foot wounds, from the science behind them to the clinical evidence supporting their use. To understand stem cell therapy, we first need to understand what stem cells are. Stem cells are the body's raw materials, undifferentiated cells capable of developing into many different cell types. There are several key types used in research. Mesenchymal stem cells, or MSCs, derived from bone marrow or fat tissue. Induced pluripotent stem cells, or iPSCs, reprogrammed from adult cells, and endothelial progenitor cells that support new blood vessel formation. What makes stem cells particularly exciting for wound healing is their ability to self-renew, differentiate into specialized cells, and secrete growth factors that stimulate tissue repair. In diabetic patients, normal wound healing is severely impaired. Elevated blood sugar damages blood vessels, reduces circulation, and suppresses immune function, creating an environment where wounds stagnate. Stem cell therapy targets these root causes directly. When introduced to a wound site, stem cells promote angiogenesis, the formation of new blood vessels, restoring the oxygen and nutrient supply critical for healing. They also reduce chronic inflammation, stimulate collagen production, and recruit the body's own repair cells to the wound bed. Together, these mechanisms can restart a healing process that had ground to a halt. The clinical evidence for stem cell therapy in diabetic foot wounds is growing rapidly. Multiple randomized controlled trials have demonstrated significant improvements in wound closure rates, limb salvage, and patient quality of life compared to standard care. A landmark study published in the journal Diabetes Care found that patients receiving MSC injections showed a 60% improvement in wound healing compared to the control group. Another multicenter trial reported that stem cell therapy reduced the rate of major amputation by nearly 40%. While larger Phase 3 trials are still ongoing, the early data is compelling and consistent across multiple research centers worldwide. Stem cells can be delivered to diabetic foot wounds in several ways. Direct injection into and around the wound site is the most common approach, placing cells exactly where they are needed. Topical application using stem cell-enriched gels or sprays is a less invasive option, gaining traction in outpatient settings. Scaffold-based delivery uses bioengineered matrices seeded with stem cells, providing both structural support and biological signals to guide tissue regeneration. Of these approaches, mesenchymal stem cells from bone marrow and adipose tissue remain the most widely studied due to their availability, safety profile, and potent paracrine signaling capabilities. Despite its promise, stem cell therapy for diabetic foot wounds still faces real challenges. Standardizing cell preparation protocols, ensuring long-term safety, scaling up manufacturing, and navigating regulatory approval are all active areas of work. Cost and accessibility remain significant barriers, particularly in low- and middle-income countries where the diabetic foot burden is highest. Dr. Vishak Varma, a plastic surgeon who specializes in advanced wound care to prevent amputation in diabetic wounds and founder of Maruti Wound Clinic, was the first in South India to start stem cell therapy for diabetic foot wounds 5 years ago. Yet the trajectory is clear. As research matures, stem cell therapy is moving from experimental to clinical mainstream. For the millions of patients facing the threat of amputation, it represents not just a treatment, but a lifeline. The future of diabetic wound care is regenerative, and it is closer than ever before.